I'm here with Stephanie Walker and Dr. Steffi, who do a rapid autopsy and tissue donation program. And I wanted to talk to them about what that is.
Yes, maybe I can start. So this is a program where patients with metastatic breast cancer consent to donate their body at time of death. We think this is really important. It provides very unique opportunities for us to understand progression of disease. We can think of heterogeneity. We just talked about how different metastatic lesions potentially differently respond to different treatments. We understand so-called organ tropism. Why does one tumor go to bone and the other one, let's say, goes to more unique sites like ovarian, like we see ovarian mets? I think this gives us a chance to get access also to organ where it's not feasible to get biopsies. Sometimes it's not possible to do that.
What kind of organ is it hard to get that kind of information?
Yeah.
For one, if you don't really have that organ biopsied at the time of progression, so you are assuming a lot of times that your tumors are still the same, such as hormone receptor positive or triple negative. So being enrolled in a program like this at the time of death allows the researcher and the pathologist to get access to the tumors that the patient has, whether it's just the tumors, the normal tissue, blood, bone marrow, urine possibly, to actually see the tumors not after post-mortem when there's a difference and the cells start to die. So if you can do this within a rapid time frame after death, you have a better outcome of the cells are better to work with for the researchers.
If I can quickly follow up on this, there was one of the important rules the advocates had in the very beginning when Stephanie, Christine, 3 other local advocates from Pittsburgh joined us. One of the first things was that they said we really don't like the term autopsy. At one point it was warm autopsy and then rapid, but anyway, we had lots of discussion back and forth and the advocacy came up with the name Hope for Others, which we totally agree it makes a lot more sense and it's a much more fitting name than something warm autopsy. Yeah.
And you need that when you're going to patients that have no medical background, no science background, when you're wanting them to donate their bodies to science. And a lot of people don't know. We know as metastatic breast cancer patients, we cannot be an organ donor like we would like to be. But this gives us the opportunities to still advance science. And a lot of patients want to do that. They just need to figure out a way how to do that.
Are you able to tell us how you can do that? Do you have any suggestions?
First of all, you can check at your center that you go for treatment to see if you have a tissue or active tissue donation program. Do a little bit of research. You have to live fairly close to the center to have adequate tissues. It's a program that needs to be explored and more programs come about that we really do need that program.
Yes, no, I agree. It's very difficult to bring the body, if it's like 6, 7, 10 hours away from a cancer center which has a program like that. One of the goals is here, like at the meeting, to have this session now to really convince other researchers to talk to their cancer centers to establish programs like that.
Are they really that uncommon?
It's not very common. It's
Okay.
not very common. And the reason is that it's not easy. It takes a team. It's really multidisciplinary, right? You have the researchers, pathologists, you have the medical oncologist, you have pathologists on call all the time. You need a clinical coordinator talking with the physicians, talking with the patients. So it's a really big team.
On the patient side, you need to have the patient agreeable to this. You need to have that patient have talked to her family or his family to let them know what's going on. And then if you happen to go home on hospice, you have to educate your hospice team nurse about how rapid they need to respond at the time of death because of that window.
Okay, I just have to ask, how rapid are you talking about? Because you talked about 7 hours or so is too far. 4 hours.
4 hours is the ideal.
Okay.
And that is 4 hours. You have to have passed away. You have to been pronounced. The families have to say their goodbyes. The funeral home or whomever has to transport the body to that center and have that autopsy done.
That's fast.
So we have, for example, identified specific changes in the estrogen receptor, which we identified in a patient who graciously donated her body to metastatic breast cancer, to the Hope for Others program. We have identified tremendous heterogeneity which we really did not expect. For example, we have a liver from a patient. We have 20 different biopsies from one liver and realize a tremendous heterogeneity within that liver on estrogen receptor expression, on proliferation. So we now have a new student in the lab who's trying to figure out, can you look at location, maybe even close to the blood vessel, right, to identify are there specific regions in the liver which are more or less hypoxic, which have more or less oxygen, for example, that you get different clonal outgrowths of the breast tumors.
Wow. That could be so important.
Yes.
Yeah. Did you want to say anything else about the program?
No, I just want patients that live close to these centers that have this program to consider that as a way of helping advance science.
I couldn't say it better. I do think that's an invaluable program. I think when you have also more rare breast tumors or more rare metastatic lesions, we will now be able to get these programs together and say, okay, we now have, let's say, 20 metastatic lesions from, let's say, ovarian metastasis, or very rare, like the orbital mets or something. I think people work together and we can do this together and really understand the progression.
Thank you so much, both of you.
Thank
It's been
you.
really nice
Appreciate
talking
for the
to you.
opportunity.
Thank you.